all the best, sir, for that. So moving ahead, we will move to our next session. The next session to look into the international standards. That is what we are planning, right? So move ahead and go ahead with the international standard. We have Dr. Op Murthy to talk about rising the Indian standard equivalent to international forensic pathologists, what they do abroad in relation to forensic pathology and research and in forensic medicine. So to talk on that, we have Dr. Op Murthy. Sir, am I audible?
Yes, ma'am.
Yes, very good morning. And first of all, my thanks to organizers for the opportunity to interact with such learned audience and the participants. So today the topic...
Sir, just a minute. We need your introduction too. So I request our chairperson, Dr. Nagi Reddy, director from Andhra Pradesh, director from Vishwa Bharati Medical College, Andhra Pradesh, to introduce the speaker. And at the end, we have Dr. Syriac Job, professor and head, Government Medical College, Manjiri from Kerala, to give the ending remarks. Dr. Nagi, can you please introduce our speaker, Dr. Op Murthy? Sir, sorry for interrupting you, but we need, we all know you, but still a small introduction.
Yes, please. I'm Dr. Nagi Reddy from Forensic Medicine, retired professor of Forensic Medicine, now at Kurnool. I would like to introduce Dr. Op Murthy. Dr. Op Murthy is my close friend since 25 years. Dr. Op Murthy has graduated his MBBS from Maulana Azad Medical College. He completed his MD from Maulana Azad Medical College, and he is working for the last 25 years in AIIMS Medical College. I think he doesn't need any introduction to anybody because he is a well-known person in India. Not only in forensic medicine, he is also a specialist in spin bowler and cricket also. Probably that may not be known to other people. At the same time, he is not only for Uttar Pradesh or Delhi, but he is well known in the entire country of India. Because recently, last month, he had come to Hyderabad to conduct the second post-mortem examination in one case. I think I talked to him for some time. So that is the one of the thing. So I request Dr. Murthy to continue his lecture. Dr. Murthy, please.
Thank you, sir, for nice introduction, though it's a little, I'm just a humble worker, an ordinary worker in the scenario. And with this, first of all, my thanks to organizers, chairman, sir, and co-chairman, sir, for this opportunity. So expectation from me is that how we are going to do the things. Whether screen is visible?
Yes, sir. You can go
Okay.
ahead. Thank you.
So raising standards. First of all, the basic ground level introspection is required. How do we come to know whether we are doing the good things or the bad things? Analysis and comparisons. If we find ourselves like we are lagging behind or we need something to improve, what is the area? What are the training? Is evaluation can manage or not required at all? And what are the ways to improve? Desire to learn, essential for examination, dedication, and learn through the experiences. And our approach to this, to achieve this goal, the good knowledge, remaining up to date in the subject, interactions with our peers and clinical colleagues, and the requirement of the time. First of all, we have to be a bit careful, like training, recruitment, and manpower. These are the major issues in India. Because the facilities at times are outdated, lacking basic infrastructures and even equipments. And in public sector, like in the government mortuaries or government departments, the workload is too much. They cannot cope up. But in private sectors, excepting few medical colleges, they are not having the workload at all or no work at all. Sometimes there is a monotony in the work, infringement on the autonomy in the practice and the decision making. The forensic unit, first of all, infrastructure, training, assessment, one international examiner, observation period after PG, ancillary facilities, and clinical autopsy. Like I had an opportunity to work in a small country like Malaysia. So where but there was a good comparison in a small country. Usually there are the two masters. One is the UK and USA. Some people try to follow the USA standards. Sometimes some people want to follow the UK and the Europe standards. And accordingly, they decide. Like Sri Lankans were more smarter than us. Since beginning in MBBS time, they included one examiner from UK or Australia. So to reciprocate that, they recognize their degrees. So you will find a quite large number of the Sri Lankans are getting job in USA and European countries as forensic pathologists. In Malaysia also, especially in masters, they call it a masters in forensic pathology. They invite one examiner from the international panel, and usually the country remains Australia and UK, so that they also get the reciprocal response from that. To return that, they provide training and WHO fellowship to their postgraduates so that they can get acquainted where they're working. And there is a freedom of work, and ancillary facilities are quite okay. You suppose you want a culture, you will get it. You want histopathological examination, you will get it. And incentive also. Suppose you are doing some postmortem or extra work or issuing the photocopy, there is some little incentive is there. And moreover, the clinical autopsies were also part of the main autopsies. So the medical legalists posted there are also expected to perform the clinical autopsy. You learn a lot in clinical autopsies. In India, our subject had the four main areas. One is the forensic pathology, which is postmortem work we do, and clinical forensic medicine related to the casualty MLC work. And third part is the toxicology, because the full name of the department is given forensic medicine and toxicology. And fourth is included is to teach the ethics. So these are the four areas. The gray areas means postmortem exposure, very variable in the country. Like those who are doing from the autopsy centers where the autopsies are done, they have a good experience. Those who are doing from other colleges where the facilities are not there, they are just having the correspondence courses, because for namesake they are attached with the peripheral hospitals or the other mortuaries. And infrastructure is definitely very poor. Not in all, but definitely in majority of the mortuary, the infrastructure is very poor. Clinical forensic medicine cases exposure is also not there, as most of them are not posted to casualty. Ancillary facilities, HP, biochemistry, analytical toxicology. I think all of us are well acquainted. For toxicology report, it takes about 3 years or even more period. For HP also, you have to struggle if facilities are not there in the department. And biochemistry people also would not like to involve in the medical legal work. The photography, now the photography has become easier. But in the beginning, the most of the departments were not equipped with a camera. Now every gentleman is having a mobile, a smartphone, which is having a camera. But for forensic photography, we must take photographs from a proper camera rather than the mobile camera, because the resolution matters a lot when you are taking a final print for publications and otherwise, or for academic use. Malaysia, as I told you, that was the part of the pathology. The forensic unit was a small unit, part of the main pathology department, and histopathological services were at liberty and easily available. And postmortem and MLC work was done by Ministry of Health and Education. Histopathology, serology, culture, X-ray were easily available, and summons only in homicide cases. In accident cases, usually they don't call, they admit your report as such. The staff and the reporting pattern. The good guidelines which we can compare ourselves, Royal College of Pathologists, College of American Pathologists, Victorian Institute of Forensic Medicine, Canadian Association of Pathologists. These are the 4 standards usually the people compare themselves and they are working. And pathology has expanded so much, especially the molecular pathology in last 2 decades. The old books of Robbins have become outdated until unless you have a current edition. And it has a branches of cytopathology, dermopathology, forensic pathology, cardiac pathology, renal pathology, hematology, and molecular genetics and pathology. So the forensic medicine is just a branch of the pathology in these countries. But you know, our degrees, as far as on paper and curriculum, is much superior, because we are all-round doctors. We are a clinical forensic medicine people, physicians also. We are forensic pathologists also, and we are toxicologists also, and we are teaching ethics also. Though in practicality it may not be there, but on paper, our curriculum, if seriously followed, is one of the best one, and you become a good all-rounder in the subject. But, and we have unlimited human resource, and especially the postmortem material also is easily available to us, because I worked for some time in Kingdom of Saudi Arabia also, where all things were done on dummies. There was no access to the human bodies. But in our countries, we have a good access to the human bodies. We are lucky in that way. But unfortunately, we are unable to exploit our raw resources. We have not used them properly. Since the digitalization has come, forensic photography has improved. You have seen the case reporting from India has also increased. The number of publications have also gone up, because we have a huge material. Now we have started exploiting. So we can be the world leader in the coming time if we train our people nicely and use our resource material in appropriate way. Now in current scenario, as I told you, the forensic pathology, we are practicing clinical forensic medicine. Some are posting, some are not posting. And toxicology, clinical toxicology is overlapping, because till now the medicine people are having upper hand in the toxicology. And as far as the management is concerned, most of the forensic men raise their hands because lack of experience, lack of confidence or competence, you can say. Then forensic and analytical toxicology. Analytical toxicology, definitely we require help of the technicians and technology people. And in forensic part, we must be able to interpret. Ethics in medical profession now is a common area and belong to every subject. So as I told you, on paper, our curriculum has a wide scope of implementation. As in 2012, I organized 3 workshops in Sirij and tried to give an idea of a modular teaching in forensic medicine. Because we have 3 years, and if we do not give the proper education to our trainees, we are wasting their youthful life. So it's a 6-monthly modules, and in one session of 6 months, you can keep 4 or 5 subjects as in the law, and accordingly you can train their people. Some module may be repeated. So these comes about 62 modules. You can take the topics in any book till you are given in detail. So if you develop, like for an example, clinical forensic method, itself is a module. Forensic histopathology is another area. Forensic anthropology, forensic radiology, firearm reconstruction, DNA profiling, autopsy work. So these are the examples. That's why a list of 62 modules was given by me in 2012, and I conducted 3 workshops, national workshop on this particular issue. The method, theory was a concept building area. We are to build the concept. Then a practical means hands-on experience. We ask the students to perform themselves, encourage them to do themselves. Then collaboration to have the right exposure, visit for relevant places like forensic science laboratories and crematorium, electron microscopy unit, where it matters, where it is more important, and periodical assessment, theory as well as the practical. And in the end, they are supposed to maintain a logbook, because in Malaysia, those people who are doing the forensic pathology at the time of examination had to show their logbook of postmortem, the 20 postmortem which they have done in detail, every aspect of that particular case, like histopathology, culture, or any other further study which was required, and discussion, clinical discussion, clinical pathological correlation. So this was the logbook. By this, how candidate has worked, whether he is a just superficial one or he has worked in depth. So for good work, you need right access to the right material information, crime scene access, because in India, majority of the police, they do not want to invite our forensic pathologists to the crime scene, excepting few exceptional cases in metropolitan cities. And circumstances they must know, investigation, though sometimes our doctors are also reluctant to go in odd hours, because most of the crime scenes are in odd hours. So they are reluctant. Then other information which should be available, investigation, medical history, social history, and backup services as per the requirement of the case. Examples. This is just a short example where I worked in Malaysia, just to show you the infrastructure. This was the forensic pathology unit. They call it a pathology forensic. That is in Malay language. This is the exterior key from the exterior. And as soon as you enter inside, there was the objectives of the mortuary. The objective key, what was the objective of this particular place? To provide complete and integrated forensic pathology mortuary services throughout, all including public holidays, to achieve excellence in meeting and made of public, taking into consideration various religious and ethnic sentiments, because it was a Muslim dominated country. So more emphasis was given on you have to respect the body, you have to respect their religion, that should be respected. Postmortem examinations are performed as early as possible, no delays permissible. Even in the night also, one was asked to conduct postmortem examination. The reports are made available within a reasonable period of time, And every dead body, the doctor was supposed to give a death certificate. That certificate that included preliminary of the person and the cause of death in brief, like in firearm injury, trauma, multiple injuries as an RTA. Because here this much you can declare to them and they have right to know. So detailed report, no, it was not given. Only summary report if they apply, especially in accident and other cases. In homicide cases, it's up to the police to decide there also. So that was the way of the working. Then ensuring quality mortuary services. There was an audit of the doctors also. Usually there was a questionnaire from Victoria Institute of Medical Sciences. They were controlling them. So they used to send certain slides and certain performers, though autopsy surgeon had to answer, just to evaluate his quality of a standard. The providing comfortable and friendly environment as a grieving relatives. So, and receive and handing over of the bodies to relatives throughout 24 hours. So these were the objective in brief, which were displayed in the beginning of the mortuary. This is how the good chair and comfort room is being provided. There is a technician who is the first attendant, and behind him there is a person who has to record, like maintain the registers and to call the doctor. So that was his job. This is the relatives room where the relatives could sit comfortably. There was a television and this was a pleasantly decorated area. Some newspapers were also there where the grieving relatives can sit comfortably when the autopsy is going on. So this was a religious sentiment to preparation of the body, different rooms for different religions, for Hindus separate and for Muslims separates, non-Muslim. This was a good coordination. Most of the doctors used to enjoy the good correlation. As far as the hygiene is concerned, this is the corridor, just displaying the neatness and you have to maintain. This was the morgue, like body has to be his coffin kind of a carrier from the ward. It was not open like we bring on stretchers and all. It was well covered and he had a specific trolley for that. So these were the cold chambers. Around 50 chambers were there. So these were opening at both ends, inside also in postmortem room, outside also, because in every big mortuary, at least the 30 to 50 chambers should be there, because at times there was a disaster. It had 70 chambers, if I recollect myself. So this is the corridor. This is the good hygiene and changing room for doctors and all kind of the, then bath also, in case you have done a decomposed body with a geyser. So you can take a bath before leaving your mortuary. So you are not a foul smelling. Yeah, and this is you can take a bath. Then your changing room have a different shoes and different clothing. So you have to take off your clothing and change your gown, wear the gown as the surgeons do. But it was not a sterile one as the surgeons have. This was the ordinary green gowns one has to wear, cannot go with his personal shoes or anything. They have to wear the boots. Like these are the different sizes, which aprons were there, and then plastic. These are every doctor had his own shoes, name written on the gum boots. He has to wear before entering. And once they enter, the changing room for ladies, different room for ladies, and then mask. Now the which is also has become common after COVID, the mask culture. These are then when you enter in the mortuary, there is a potassium permanganate solution in the beginning. So you have to wash your gum boots so that you are not carrying any dust or anything from outside. So that is the way to enter in the mortuary. Then these are the trolleys, detachable trolleys. You have to take out the bodies at both the chambers were opening from inside. And here you can find these are all kind of tubes as per the standards, international standards, red top, purple top, and this one. See how they were using. Then this was a trolley having the weight. This is the, in brief, different type of gloves, whichever suits you, plastic apron on the gown you want to wear, and the instructions to the doctor, just to show you in case they don't remember. Okay, red tube is used for this particular purpose, purple is used for this particular purpose. So, and these are the number of emergencies. And in case you are touching the phone, you have to use the tissue paper. You cannot touch directly, like blood containers. These are the various. This is the autopsy number was displayed on a table. And this is a viewing gallery, like students can watch, police people can watch, or whosoever are the visitors, they can sit in gallery. And there is a microphone also. They can communicate to the doctor who is conducting postmortem. These are the 3-4 tables side by side in one dissection area. And this is the conference room on the side of the mortuary where the doctors can sit and discuss the case daily or weekly as they like. This is the morgue attendant, Mr. Hussain, who is taking out the body. And there is a weighing machine also, like weight will automatically come on this trolley. This is the way he has put the body on the trolley. And this is one case here, myself wearing the all gowns and this protective measures. This is a body fished out from a river, and his maternal uncle kidnapped him for the ransom. And after putting him in a briefcase or a suitcase, he disposed in the river. And these are the animal or aquatic animals bite marks. And this was a, you can say, plastic wrapping around his mouth. So this is the, before doing the postmortem, everybody was supposed to get the body identified by the relatives. It is his father and other relative. They are identifying the body with a proper covering and all. So the doctor has to do himself in his presence. Yes, the body has to been identified. It's the responsibility. After that, the body has been put and the postmortem has been done. And the full complete postmortem culture was there. No partial postmortem was except in clinical autopsies. These are the resident doctors who were doing master pathology. They are under training because this is an examiner where I was also part of the MRC, this Masters of Pathology examination. This is Stephen Cordner was the international examiner, myself and one another examiner, Dr. Shoram from another university, and he is a candidate who is explaining the things. So this is the way of working. There, the table trolley was also there. You had the all kind of instrument, whatever you require, neat, clean, and put inside X after use so that you can use. Never touch the door. They have put this rope around this so that they could pull the doors without touching. So you are not spoiling. The biological disposal, as we are disposing the biological waste, different kind of a dustbin. This was for the heavy instruments like blades and all. So this is the wrong way of handling the way. This is the right way. Feel like you have to handle the urgent phone call if there is. Otherwise, avoid. This is a weighing machine for the organs. Then fumigation. It was weekly done. Now the UV lights are put in our mortuaries, but fumigation once in a week was essential activity. Sterilization also for all clothing, and steam sterilization was very common. For disposable waste, for the different kind of coloring is there. Like we have also an act for the disposable of the biological waste, as I told you. Minimum storage guidelines as far as the Royal College of Pathologists, they say these are the different time limit: wet tissue 6 months, accession period for 1 year, quality assurance document 2 years, paraffin blocks for 5 years, autopsy authorization form for 7 years, an autopsy report and slide 20 years or more or permanent. Then health plan for the staff. There was a health plan for the staff also. Periodically, after 2 years, they were screened for tuberculosis, hepatitis, and health surveillance was there. Awareness among the staff, regular and periodical reminders for the hygiene and for health, regular annual checkup, mental fitness program, so that they do not indulge in alcohol, cannabis, or they do not become schizophrenic or become kleptomanic, like stealing from the relatives and personality disorder. This is the way like the students, one Sudanese student is working. The general precaution, treat all the tissues and blood as a contaminants and minimum splashing and avoid touching nose, mouth, eyes when you are conducting postmortem. So especially the protective garment, plastic sheets, and safety goggles one has to use. Air purifier, 12 cycles per year. Suppose it's a closed chamber, so 12 cycles should be there in closed autopsy room. How some are using and powdered air in a purifying respiratory, morning and evening walk, deep breathing exercises, low fat diet, recreational activities are must. So our mortuary was having television for the workers. The TV was there, so in the weekend time or weekend, especially leisurely, they can watch the TVs, they can have the recreation. Especially in infectious bodies, see how this is the best now, it's become common after COVID. Tissue, how the tissue was done, collection, handling, processing, storage, transport, laboratory handling. The procedure was well done. This is the histopathology was a routine one whenever required. This is the grossing. After keeping the sample, you have to make the grossing. And so this is one case, like I did a case, you can see the arteriosclerosis, and here you find the histopathological changes also. So varicose vein, which was sclerosed. So the one teacher had a very minor trauma, and after that she was found collapsed in the bathroom, and there was no foul play. So these minor injuries can lead. Then milk aspiration in a child, like we were suspecting aspiration in that particular child. So there's a milk aspiration in the specific strains for the milk. The first aid measures were always available. You have to do the first aid like wash with a soap, iodine solution, betadine over it, and fecal matter is rich in tetanus immunization is recommended, and blood, fecal matter, formalin splash in mouth or eye, wash at least 5 times, 5 minutes in running water. That was the indicated one. One must have waterproof adhesive test in a first aid bottle of antiseptic, dressing material, eye bath, and the first aid training to the staff. So this is the forensic unit. And sometimes I had an opportunity to go into jails also, in the custody deaths where there was the alleged, and after that, this was a solitary confinement where the person had died, and it was a big gangster, drug peddler who died there due to fall. But it was alleged he was murdered. Like a lot of crime scene investigations. We used to enjoy because simultaneously there was a forensic unit attached with your area. They used to send the vehicle immediately as soon as there is a recovery of the body. It's up to you, you go or not. But I used to prefer to go to the crime scene. So that was the way of working. Like this was a long back. Now I think 17 years back. 2005 I was there. But Saudi Arabia, it was under Ministry of Health and Education. And external examination, sampling, usually they preferred external examination, X-ray sampling was the first priority. And after doing the X-ray sampling and external examination, then only they used to conduct autopsy, not before it. First, they used to do the investigation, the postmortem. The report was in Arabic, and you have to write the reports in Arabic. And only Islamic people can appear in the court. Otherwise, they just used to send the reports. Like I used to send my reports as it is, because the court, I was not permissible because of the non-Muslim. So this was the Saudi Arabia, very dry country, lot of dates, like all dates you can see, the full of dates area, very hot, especially in summer. If you walk for 10 minutes, you will get fainted. Like this was the sea also nearby. And for just 10 kilometers away, there is a desert. So these are the working conditions. So autopsy authority means the procedures was there. Usually two people used to conduct autopsy after authority from the court. And types of the cases depending on, and the morning meeting was must to have the eye coordination, to have the good cordial relations, and to settle the petty issues. Because if we do not meet, we do not settle our issues. So that is very essential. So this is the way of working there. Like this is my All India Institute of Mortuary, where I was working, still working, you can say. And this is the cold storage. The bodies are put in like a platform and all. And this is the cold storage, like for keeping fruits, vegetables and all. We still maintain the same because the electrical failure and maintenance is very difficult in India. So most of the people resort to this kind of mortuaries where they only one hall and putting 10 air conditioners. So that is the way you can say. This is the stretcher carrying the body, in contrast to what I showed you. Though we are also, this was a table, mortuary table, fixed one. But now we have also added few facilities. Now this is the table. We have put one X-ray machine and one CT scan also. Whole body CT scan is has been purchased. So this is the current one which we have modified, and because most of our people also got an opportunity to visit the foreign mortuaries, because the All India Institute is a privileged place where you get 5 permissions to go to the national conferences and 1 international conference per year. So most of the people, those who want to go, they go for international conference every year or every second year. So you get a lot of exposure also. In Germany also, where I went, there was a attached camera in the mortuary itself over the table, and the control was in a hand. So wherever you wanted to fix it, you could take the whole body photograph, you could zoom it, you could take a close-up also. So that was also a very good thing I saw, especially Wolfgang, I think, was the professor at the time. This was a new device, one of our resident doctor device during a COVID time for taking sampling. So now is the COVID over, almost over in India. So these were the basic facilities. And my department at present also situated in this building. But we have put few facilities. These are our attendants sitting in the beginning, and this is a small museum. So our main works, we come to know, is teaching, UG, PG, PhD and training, medico-legal postmortem, clinical postmortem, and the toxicology work, research, and honorary work on examination, opinions, and that is the honorary work which we use. We go to different universities for examination. So it depends the personal expertise, standards, integrity of evidence, fair presentation of findings, understanding of criminal justice system of this country, understanding the service obligations and the law, and service provisions of our medical practitioner, forensic medical practitioner must know. The entry point job description. First of all, whenever there is an entry, it should be clear to the person what kind of a job you are going to do. What is the main purpose of your recruitment? Job description. What is your position in the organization and department is going to happen? And who is your immediate superior? Who allots you the work? Like how many forensic people are a little crazy in that way regarding allocation of works. Because you might have seen most of the surgeons, when they start surgery, they are given a like independent clinics. And whenever they perform surgery, usually they are responsible for their act because they are the responsible people. That's why they are recruited as consultants. But in here, the forensic work, some places, the HODs have the obsession, he will decide. Anyway, when the other people are equally competent and you can just allot the case and let the person manage. Why do you want to interfere and poke your nose because you are getting some influence or you are getting some gratification or you want to show the bossism? So it's a bad culture prevailing in the country, which stops good working conditions at some station. Not some are very good people, very cooperative. Then how many people work with you? Do you have some support or also not? Like in our department, is a very big department. We have 13 senior residents. And every 6 months we get 3 junior residents, 18 you can say in 3 years time, 18 junior resident PG and 13 senior, 31 doctors, and we are 4 faculties. So it's a department, 9 faculties. So it's a department of 40 doctors, and besides that, PhD students and other paraphernalia and supporting staff is there. So total in department around 60 people are working. So it's a huge department. Though in comparison, the private colleges must have 1 or 2 people. So that is the, you can say, in government sector, since when the seats were increased in PG, there are a lot of rush people. But why should people join if there are no jobs? And if there are jobs also, like they should be particular, they should be satisfied with the working conditions. Otherwise, the drop out rate is very high in forensic medicine. Why should I continue in this specialty? Because to overcome this, we have to develop skills so that they feel important. They are not dependent only on government service. Like if they go in a field, if you are a clinical physician, you are a good toxicologist, you can survive at your own because of your skills. Then what are your key activities? Charter of duties and responsibilities, do's and don'ts. This is also important because you might have seen a lot of immature persons, those who start uttering any nonsense on media. Especially you might have seen in Sunanda Puskar case, Rajput case, Rajput, one filmy actor who died, and many other, so many other cases where immature professionals, they find their specialty or recognition in media. They do not have faith on their, because you see, there are so many people in mortuaries in India. Everybody is silent and not working. Are they fool? No. But they respect their job. They respect the integrity, trust, and confidence given to you. Breach, so they do not like to indulge into breach of trust. Because once you are in services, you are working for police and court, you have no business to interact with the media. But with different people, identity crisis, because, and this is specialty because the skills are not developed, they develop identity crisis. Some is becoming a lawyer, some is becoming a part-time preacher, some is becoming more interested in roaming around, and some is becoming consultant, but they are not becoming forensic pathologist, forensic medicine and physician. Why? Because lack of recognition in the society. The society recognizes only valuable and useful people. Nobody wants useless people. That is the dictum of the society. So what are the main decisions you are taking? What are the main areas? Then are you equipped with the photography, histopathology, crime scene, research, sampling, dissection? So this way, SOPs, some centers may be having, some may not be. It was not a culture, but now the people have started realizing its value. As standard operating procedures, not to pin down anybody, not to punish anybody. This is just to improve the working conditions and to get a good quality work. To guide you in this, these are, you can say, advisory in nature. These cannot be compulsory in nature. Yes, in this circumstance, because every case is unique. You have to use your common sense and discretion. So, but SCP do help if you are forgetting anything. So you have to do, I think this will be discussed by another speaker, Professor C.B. Janiji. And major topics, as I told you, what we are doing today: clinical forensic medicine, pathology, toxicology, expert opinion, postmortem and clinical cases out of jurisdiction, private and public cases, which we are not doing here. The private practice. Now, few private practitioners are coming in forensic, but majority are in a government sector. And the court also give more weightage to the government people. Now, how to assess competencies like crime scene, confidentiality regarding scene, describe and demonstrate and ensure the material and medical notes, then scene briefing, establishing scene. This is how you are going to assess this. Skills are this and knowledge is this. This slide particularly indicates that. Okay, you are expected to have this knowledge and your skills will be evaluated by this way. So that's like you can say modular teaching. Advantages, definitely you improve standard. Disadvantages there like police. In a country like India, where like a freedom means indiscipline, anybody can, you can say, throw acid, can do the vitriolize of the another person because of his rivalry, professional jealousy, or any greed. So minimum standards, they definitely help to complete work, remain up to date, and the up to date in the postmortem duty, as I told you. These things are very essential. Report writing component should be clear. Writing skills among the professionals, because some are very poor writers, some are good writers, and histopathology and investigation, subsequent opinions and actions, be like what you are going to do, checklist. Then under audit work. Audit, especially the peers, those who are good and seniors, they can audit your work, or somebody's means cross-checking of your reports. One way you can say it. Immediate auditing is the cross-checking by your friend. You are not left any column, you are not missed any finding, neither there is the cut and paste injury, because now most of the reports are the computer written. So there's usually cut and paste is there because there is one pro forma in this place of male, you are written a female also. When you go to court, there is embarrassing situation. So it's always better to cross check each other. Yes, okay, just have a look. Then evaluation, acceptable rationale, then agreed standards, sample size and selection, method, data, analysis and interpretation, changes required, and evidence to demonstrate, benefit to autopsy, to quality work and reporting, for a high quality working, to slow working. You see, still I would say one thing, the traditional autopsy is the best autopsy. You have a lot of opportunity. Now, many people are talking virtual autopsy. It is not practical in India. because it's a very costly affair, 3 to 5 crores, and that most of the mortuaries cannot afford it. And this simple X-ray machine is more than sufficient for the forensic work, because the forensic situations are limited where you need the X-ray help. In trauma cases, especially to document the fractures, and especially in firearm cases to position of the bullets, number of the bullets, and in other cases where it is needed, it is just helpful. The handful, like 10, 12 situations are there, we definitely need it. But if you say, you know, this is an alternative to the traditional autopsy, no. It is a failure in many circumstances. It cannot detect the organ pathology as such, right? There are a lot of misinterpretations. So it can be part of investigation, like we are having ECG to evaluate. We are having X-ray to corroborate. So this is virtual autopsy is also another corroboration, but not an alternative to traditional autopsy. Internal quality control, as I told you, peers are the most than your seniors, and establish a departmental standard for a weekly. The audit will be done, who has done, not to punish anybody or to harm anybody, but just to warn them, okay, you need to improve on these areas. Then audit report may be concordant, minor discordance, and discordance, and differential diagnosis only unable to be assessed. So these are the ways, like how you say, teaching duty, delivery of teaching, what you are teaching, one must know now, how to prepare a lecture, what you are going to deliver. It is not just you go and do the gossip with the students and come back. You have to develop your objective, action plan, what material to be included, what is to be excluded, what to be told, what not to be told, method of evaluation, consultation, examination duties, and coordination of the teaching and review of the teaching. Okay, gentlemen, you need to improve upon this. Nobody like the advice, but it is must to improve the standard. Right, in the beginning, everybody is a novice, and we should not mind it if somebody is telling a good thing to improve on this. Indicators of the quality teaching, outstanding teachers recognized by students and colleagues. The teacher recognition and the best recognition by the students. Like we had a very good teacher, Professor Vishnu Kumarji, and once he was in the class, it was a pin drop silence. And he used to teach with the traditional cards he used to keep, and just to remember, he just see the card and then start teaching. And a very good control over the voice, good command and language. So everybody was impressed by his teaching, and still the students remember him. Yes, he was a good teacher. So in physiology also we had a very good teacher. So teachers are recognized by the students. Development of effective and innovative educational methods and course material, evaluation of teaching performance, ability to teach at the more than one level, high demand for speakers, orations, and meeting. You will be in high demand if you are a good speaker and you teach well and you tell them well. And counseling skills, teacher must have the counseling skills, module coordinator, organization of sessions. So these are the responsibilities. Students, UG, PG, as I told you, blueprint of your forensic medicine. Like you are teaching this way. Okay, this much percentage of weight and examination questions will be there. This is just an example, not a like you are going to follow it. When the paper is complete, this much have this much of the topics and the numbers, so that no confusion. You have to read every topic. This is just the students are supposed to read every topic. Professional standards, commitment to the quality, transparency, and accountability, clinical governance, quality governance, audit, revalidation, SOP, research, public policies. Forensic person should not work in isolation. You learn so many things from the clinical brothers. Because you are interacting, you also learn, they also get benefit. So unjustifiable departure from standard, if repeatedly done, requires probing of the person. Yes, whether this person is doing willfully or is ignorant, or there is a cognitive, you can say, incompetence, right? So these are the ways how you have to demonstrate yourself. So demonstration of knowledge, and you to demonstrate you can maintain confidential privacy. Integrity means in forensic work, the integrity is very essential. And these are the Canadian Medical Association which have downloaded a good expert. You must have this much of the qualities, direction for the specialist. Yeah? For quality in forensic, two-is setup. You are working, you cannot generalize, because somewhere the facilities are good, somewhere the facilities are not good. So you have to compare, and but best should be taken out from the people. That is the job. Your contribution to the college, because the institution which has employed you, you have certain moral duties, departmental duties, administrative roles, examination roles, procurement, student and staff monitoring, social and cultural development, liaising, and different roles depending on the as the work assigned to you. So you are a multivarious worker, and usually now is demand for the those who can perform multiple tasks. Monotasking people are less preferred, right? The search, how you have to plan, then accordingly to first of all they should be taught biological writings, see how to write the uniform guidelines for biological researchers or biomedical researchers, then how to avoid plagiarism whilst you are doing it. Then they start learning orientation to the research, you can say. Publication, quality publications, professional activities, collaborative efforts, review of new development. You have to do, like few are the PubMed journals. PubMed journals and index journals means these are available to the world scientists. Local national journals which may not be in a PubMed or Scopus, but nationally they are available. But now the National Medical Commission and UGCI have made it compulsory the article should be either in an index journal, either a Scopus or PubMed or any other agency, so that its visibility is there and minimum standard is maintained. That is the way. So I think none of the Indian forensic journals are in PubMed. Scopus, yes. We have many journals now in Scopus. So, but now since the digital photography has come, the quality of publication has gone up. Initially, we were struggling for the photographs, good photographs, but still the people have to be taught how to take a photograph, how to label it, how to clean it. So that that comes only by working. Then you say, oh, this is artifact, a lot of the droplets are coming as a good photograph is not coming. So if water surface is there, shining surface is there, how to keep the background. These are the ways like you have to do. Then you have to update yourself, and person should be well aware and attend conferences also when opportunity is there, and acting as a discussion, the active discussion should be there in the scholarly networking, colleagues work.
Murthy sir, sorry for the interruption. So, sir, your time is exceeded. Please conclude, sir.
Okay, sir. Okay, sure. So public service to the society, which we have to do, an indicator for the good public, the leadership roles, service on a major government commission. Sometimes you are part of UPSC, sometimes the governing body, and sometimes the law framing activities. So these are the things where you can, in journals also you can participate, the postgraduate examination, the learnings which have to be self-directive, formative, systemic exposure, needs of community and competency-based, and international and national competency. Suppose you are producing the national products or international products, that depends on you. So some are international products, some are the training, trainers, recognition, certification, evaluation. These are the way blueprints. And assessment of students is also very essential. If they defect in Indian system, uniform training is lacking, uniform working material is lacking, private sectors more theory than practical, government sectors overburdened, histopathology component is very weak, which is better in European countries and American countries, but they are lacking in clinical forensic medicine. They have a different specialty, different part at all. ISO standards and SOP auditing not in place, facilities and infrastructure varies, super specialized, subspecialties still lacking. One or two institutions have started. So good planning on paper, almost full of all-rounders, good exposure to work in majority of the cases. In 6 years, there is a fair exposure to all variety of cases, multi-purpose worker we require in nowadays working. So current MD examination, these are the 4 papers which we can more elaborate, and so that practical 2 days, now the people have reduced the practical for the half day. 1 day they say, but it is finished in half day. The examiners come at 11 o'clock, then they have a tea, 12 o'clock is there, 12 o'clock they start examination, then 2 o'clock is the lunch, and by 3 o'clock the examination over. So that is a fraudism and a pseudo expert you are producing. That culture should be discouraged. So DMJ, these are the ways how they do it. MRC path, they give 20 slides in their postgraduate examination, so that the candidate is well aware about the histopathological aspect in sudden deaths and important cases. Then short cases and long cases, and good side. We have these specialties. Negative side, as I told you, no case book is prepared, log book is prepared, not much histopathology, periodical evaluation is lacking, too much litigation and court work, poor facilities and infrastructure, and interdepartmental posting and coordination. Very variable. Shortage all over, no incentive, scope limited, too much headache and unpleasant work. Recognition of work is not there as expected. Growth graph is not there of the professional. So that is the way how we can improve. Act, plan, do and check. Service excellence, department and initiative, employment screening, training, recognition, performance, and all metrics. So this is the standards of how we are going to, and we need the trained people to improve India. And India has a great scope. So that's in brief, you can say, about how we can raise our standards, introspection, comparison, and then implementation. Now it's open to the question. Thank you very much.
Thank you, Murthy sir. That was a good presentation, and you have shown the standard of the mortuary in Malaysia. And there are many other similar institutions in India also. For example, Goa, Sapekos developed a mortuary just similar to this, but it is not that functional. That is an issue. I can summarize this in 3 terms. One is development of infrastructure. Second is involvement of histopathology. Now the histopathology work is left with the pathologist. As a forensic expert, we should take that responsibility also. Third one is sincerity to the work. Last week, I visited one government institution who applied for starting MBBS. They constructed the mortuary, and the table is the good old granite table. There should be steel. Why? I asked, who proposed this one? Our senior professors recommended that one. So we should orient ourselves how we have to develop our own mortuary. So that recommendation should be sent to the government. Last time in all the state, we spent crores for buying PPE kit, gloves, and everything for COVID. So money is not a problem with the government. If you give proper recommendation for the development of proper infrastructure, then only we can develop. Otherwise, we cannot. And the mortuary should be exactly like operation theater. So based upon in an institution, there are operation theater, that mortuary should be exactly like that. that standard as a forensic expert, we should recommend, we should request the authority to develop in our institution. Then only we can improve it. Okay, sir. If any doubts, we can undertake one or two clarification because we are running short of time. So we can entertain one or two doubts. Over to the participants.
Yes, sir. Sir, in the chat box, we are actually having debate about virtual autopsy, and that's the hot one that's going on there. So Dr. Op Murthy, if there's one last say about virtual autopsy, what would be that you would like everyone to, because they are like, aren't we supposed to update?
As I told you, virtual autopsy is not an alternative in India. It is just a corroborative investigation like ECG, X-ray, and no more importance than it can be a test at present. And India cannot afford it, because to afford 5 crore rupees in India to every mortuary where the infrastructure itself is lacking is not feasible in 2000 mortuaries in Indian setup. Only few institutions where the money is not a problem and a lot of grants are there, they can purchase it and can show as a exhibition piece to rest of the countries. Rest, I think, as far as the practicality is concerned, the digital X-ray machine can do enough job, you know, as far as the forensic situations are concerned. So yes, where there is a liberty and where they do want to purchase a CT scan, whole body CT scan, they can have it. But you see, there are issues of training staff, installation, developing infrastructure, and then ultimately, because we should not be slaves or crazy people, because sometimes the Western people, they want to dispose of their material which has become old. They want to sell to the Asian countries for just for a purpose, because you know how the virtual autopsy started when the one CT scan machine became old. Now what to do that machine? They thought, yeah, this poor forensic people, I think give them as a donation, so they can also do the CT scan and all. And from there, there's some people, yes, did some CT scan. Okay, this is a new art to the forensic men. They started exploiting, like Switzerland and other people. They are giving training for 15 days on autopsy, because after training, then they will enforce them or they will advise them, because they become a touts for those countries. You purchase this machine, we will give you incentive, you come for a training. Now, okay, advantages are there, like especially in Muslim countries, where they do not want to open the body, right? So there they can purchase and they can do, okay, on external examination also, and for internal thing we can do this part. But it's a long way to go where virtual autopsy can be seen in reality in all mortuaries in India. Only in specific centers it can be there, like tertiary centers or referral centers. Like we have developed All India Institute of Medical Sciences, but other medical colleges of Delhi are not having. But we are not serving as any purpose excepting the self-proclamation or getting some weightage to show to the others, okay, we are a little superior because we have virtual autopsy equipment, nothing more than it.
Yes, sir. Thank you, sir. I think there's another Dr. Aarti who asked about the status of the virtual autopsy in AIIMS, and that's clarified, I think. Now, Dr. Neeresh has one more question. He asks whether the existing CT and MRI missions, which are
existing people, that it is not functional for the practical work. Only few research work are going to standardize the things. First, they have to do the research and learn the things. So they are doing the experimentation for academic purposes. As far as the medical legal purposes, it is not used yet. And the people are not using it frequently in all the cases, excepting they are doing some research work on a project related. They have taken one project from ICMR where the grant of 5 crore was taken. So they are justifying that grant. Yes, we took this grant and We are doing the experimental work on it and academic work, nothing more than it. It is not in practicality. It is not being helpful to any other institution of the country. Like they are doing referred cases, they are helping in the referred cases, nothing like this.
Can I interject?
It is self-boasting, I would say.
Yes.
Can I interject?
Sir, quick. Yeah.
The question is, can you use an existing CT or MRI? Yes, you can. We have just slightly tweaked it a bit. We use a pediatric one for children. If we use the pediatric setups for when you want to do very fine CTs, or if you have really skeletonized bone which is very light compared to a full fleshy body. You know, if you have a big fat body, you'll get streak artifacts from the thick fat body absorbing radiation. You know, like metals also interfering, producing artifacts. So you can tweak it a little bit. You can do that with the help of the company technicians, if you call them down. But one can use the conventional CT modules. The difference between our PM CT work and the clinical CT is done in windows, small blocks, head, neck, shoulder, and all that. We're not worried about radiation. We can do the whole body, but the file is too big, so we stop at the knee. Then we do from pelvis to foot a separate block. Okay, so you can use it. I think that's the answer which is wanted.
Thank you, sir. Thank you, sir. I think that throws a light on the discussion that's going on in the chat box about the virtual autopsy, where it's, as OP Murthy said, everything cannot be taken in. Like only those things that work for our system can be taken in. And yes, the prevailing machines can be used for research and other purposes also. And in certain cases where Dr. George pointed it out. Thank you, sir. Thank you so much. And I think further questions we will mail to you. Thank you to the chairpersons also, Dr. Nagy and Dr. Job for joining with us today. Thank you, sir. That was a wonderful session. So for our next session, we have Dr. Tasrish. Thank you, sir.